The Covid-19 pandemic has changed the face of dentistry in the UK. It is said in many quarters that this is not only going to be a short-term effect, but it will affect dental practices moving forward over the next 1 to 3 years. It is reported in the media this week that over 70% of practices are concerned that they will not be able to maintain financial stability for more than 3 months. Equally, over 20% report that they can only survive the month of April. It is very difficult to predict the times ahead, but clearly practices are having difficulties in seeing a way through this pandemic situation and allowing their businesses to continue at a later date. Over 70% believe that they will not be able to return the same patient numbers to their practices once this pandemic is over, and this of course will have a worrying effect on both revenue and also patient numbers, as well as the sustainability of our teams. A number of practices have tried to secure additional funding during these uncertain times, but it is reported over 90% have not been able to secure credit. There is greater concern amongst private practices where their income has immediately stopped and revenue has fallen dramatically, and they report that they will face considerable difficulties within the next 3 months. It is very important to plan the way forward at this time of great difficulty and uncertainty, and that's why we have created for you the VINCO model to consider in terms of maintaining and building your practices in the future. We need to visualize the picture accurately. We need to take stock of what is out in the dental domain by way of information and what is actually true and what is merely speculation. You are urged at this stage to visualize the picture, but use evidence and not supposition to make some key decisions as to how to move forward. Accurate visualization of the situation is most important within the concept of this model. Within this model, we need to understand the impact the COVID-19 crisis has within our practices. Clearly, we are operating a diminished service and therefore revenue has fallen. We need to understand the impact not only on us as practice owners, but equally on associates, members of our dental team, and our patients. It is only when we have accurately assessed the impact on our individual practices that we will be able to consider how best to move forward with a view to returning to times where our revenue meets our costs and allows us to have a satisfactory income. We need to negotiate within the VINCO model because it is very important that we are able to align our team members into the strategic and operational decisions we are making so that when we are able to return to practice, we are all able to follow the same direction moving forward. This is an invaluable opportunity and equally invaluable time to consider how best to move our practices forward. We also need to understand who we can negotiate with currently to reduce our standing costs and what financial assistance and indeed operational assistance we may be able to get from either banks or external organisations. We have to accept there has to be change post-COVID-19, and we need to understand that changes will be required because it is said in many dental quarters that we will not return to the same model of providing high street services to our patients. There may be significant changes in the operational model for practices and indeed our standing costs in terms of infection control. There is likely to be a feast-famine situation in that in the early months we will get many patients returning to our practices as they have only received emergency care previously and have unfinished course of treatment. It is recognised that there may be a famine period thereafter as confidence in our services needs to be restored with patients, and patients may have reduced ability to spend in dental practices as we may be in a position of recession following COVID-19. It is equally important that we have structures in place to assess the outcomes of any change we make to ensure that we are on the correct road going forward, and equally we can demonstrate a degree of success when using this VINCO model. VINCO is a Latin word and means to overcome, conquer, surpass, and defeat. These are the qualities we are going to need to overcome the inherent problems that are associated with the pandemic situation we are in. We need to have a model to rebuild our practices and consider how best to take our businesses forward. We need an integrated approach with our teams, our patients, and commissioners to make sure that we have viable businesses going forward and they are able to meet the requirements of tomorrow's dental practice. So let's chat.